Knock, knock. Hi, guys. Dr. Abby Waldman. I'm a dermatologist at Brigham and Women's Hospital in Boston, and I got this request to film a video on getting rid of under eye circles and puffiness. So there are many different causes of under eye circles and under eye puffiness. It's important to look at the anatomy to see what causes those lines underneath the eyes and the fullness of the fat underneath the eyelid. So the body is remarkably smart. In evolution, it has created these fat pads around the eyes, and they're kind of like putting the bubble wrap in a box when you send a glass bowl across the country. That bubble wrap keeps the glass secure and keeps it from, hitting things and breaking. So really, that's the same thing with your eyes. You have all this fat around your eyes that keeps them from rolling around in your eye sockets and keeps them snugly in place so they don't move. It would be kind of creepy if our eyes were like always falling out of our eye sockets every time we look down, right? So that fat and then the skin and ligaments around it is what keeps your eyes in place and keeps them safe. These ligaments shown here are what create those lines underneath your skin. So you have a retaining ligament right underneath the eye that creates that first fold underneath the eye. And then you have a malar ligament that goes down here, which can create sort of an indent right here, which I have, as well as accentuate the fat that is underneath the eyelid. Another unique aspect of eyelid skin, it is that it is super thin. It is much thinner than skin even elsewhere on the face or elsewhere even on the body, except for maybe underneath the armpits and in the groin. Those areas can be very thin as well. One downside of that is that you really can see the underlying blood vessels underneath the skin pretty obviously, and things that you put on your eyes absorb that much more than anywhere else on your face or certainly on your trunk. Because of how thin that skin is, fluid collects there much more easily than it does anywhere else on the face. So let's talk about the first cause of under eye circles and what to do about it. The first cause is related to that fluid. So fluid retention is a really common cause of under eye circles and under eye swelling and accentuation of the lines underneath the eyes. So unlike the heart, which pumps blood throughout the body, the lymphatics or the fluid of the body is actually drained just by gravity, old-fashioned gravity. So it tends to move with physical pressure. And you'll realize that if you've been standing all day, you'll notice that fluid will start to accumulate in your feet and your lower legs because gravity has brought it down there all day. And then when you go to sleep and put your legs up, then that can come back. Or if you go on a nice walk or run, the muscles contracting in the legs will actually move that fluid back up towards the heart. So when you lie down to sleep, a lot of the fluid and the lymphatics will again go to the lowest point of gravity, which will be your face, and it accumulates the most under the eyes because it's that thin skin. It accumulates that fluid and really shows it when that fluid is there. And so often that is the most pronounced when you first wake up in the morning, and it will get better throughout the day with gravity just from sitting up and having gravity kind of pull it down throughout the day. If you're a side sleeper, you're gonna notice more swelling on the side that you sleep on. Again, gravity. And if you tend to sleep upright, either on a pillow or in a chair, you're gonna notice less periorbital swelling in the morning. So even though the fluid is going to kind of drain with gravity throughout the day, there are ways to make that fluid drain a little bit faster. A lot of them are on social media, and the keys are ice and pressure. So pretty much all of them are the same. This is just a jade roller put in the freezer, so it's very cool. And you can basically help move some of the fluid out from the under eye, moving it from medial to lateral. Really, really gently. And that can help both constrict the blood vessels there, as well as physically move some of that fluid out to the lymphatics and help it kind of clear away. So again, there's nothing unique about this. You can do it with a piece of ice. You can do it with an ice roller. You can do it with a cold spoon. You can do it with your fingers. Just again, being really gentle. Remember that skin is very easy to irritate, very thin, but a lot of those techniques that you see on social media do work You know, again, they're temporary and probably it's gonna drain no matter what you do over the course of the day, but it certainly gets you there a lot faster. Under eye silicone gel sheeting also works in a similar manner. Those have become popular. There are some that even contain active ingredients, and those can be applied under the eye, and again are just providing like a little bit of compression, a little bit of pressure to help that fluid not accumulate underneath the eye. On the other hand, things that increase fluid retention are going to increase the puffiness under the eye, and that would be a high salt diet, dehydration, as well as just poor sleep. So moving on to the second cause of under eye circles and puffiness is inflammation. So the symptoms of inflammation are dilation of the blood vessels. So you're gonna notice increased redness related to the blood vessels, sometimes even a purple color because the blood can look purple through the skin. You're gonna notice more swelling, and you may even notice something called post-inflammatory hyperpigmentation, which is a dark color related to inflammation. That's why it's called post-inflammatory hyperpigmentation. So inflammation around the eyes can be due to nasal allergies, also called allergic rhinitis, or your normal seasonal allergies, essentially. It can also be caused by allergic or irritant contact on the eyelids, meaning something that you're putting in onto the eyelids is causing that inflammation. Also, airborne irritants or allergic contact can cause a lot of that swelling. Things that are coming from the air tend to first show up around the eyes. Again, just because of how sensitive that skin is. And then just if you have atopic dermatitis, also known as eczema, can cause that same inflammation around the eyes. In fact, it has a special name in that case, and it's called a Denny Morgan line. One sign that your eyelid changes are being caused by allergic causes or inflammatory causes is that your eyes are itchy. You may have the desire to rub them, or you are rubbing them. You may have some nasal itching as well. You may have some nasal running, as well as eye running and teariness. So treatments for allergic rhinitis, including using your nasal spray, your nasal decongestant. Also, nasal steroids can help quite a bit to decrease inflammation, and then oral antihistamines as needed. And all those things decrease the inflammation, they constrict the blood vessels, they decrease the amount of swelling and itching in the area, and decrease the post-inflammatory hyperpigmentation. For allergic contact and irritant contact, the key is you wanna identify what's causing it. Oftentimes, it's something that you're putting on your face, so like an eyelash serum, or an eye cream, or it can actually be something you're being exposed to in the air, or it can be something on your nails, like acrylic nails, for instance, and then you're touching your eyelids. For symptoms of allergic or irritant contact, as well as atopic dermatitis, can include really short-term use of low-dose steroids. You don't want to use them for long times. You don't want to use high-dose steroids because, again, the eyelid skin is really thin and you don't want to thin it out further or cause obvious blood vessels from the steroids. So this short-term, just to kind of get it under control, and then you transition to a non-steroidal medication, and those can include topical everolimus or topical tacrolimus, as well as other treatments. Once you identify and treat the underlying cause, typically the lines, the hyperpigmentation, and the puffiness around the eye is going to go away on its own over time. It usually resolves without any need for further treatment. So moving on to number 3, which is natural aging. So as we age, we lose collagen in our skin, we lose the elasticity of our skin, and the fat pads actually move and become atrophic, and the ligaments loosen. So everything kind of sags down. Even our underlying skeleton, our underlying bony structure actually resorbs, so that the structure holding up the fat and the ligaments is no longer what it used to be. And so then again, you can get a herniation or a puffiness of the fat pad out of the ligaments as things change and move. The thin skin of the eyelids becomes even thinner as we age, and so you get more prominent blood vessels, more obvious lines underneath the eye. So what to do about this? So if you already have a skincare routine, those products are going to help under the eye the same way they help elsewhere in the face. So if you're using a retinol or another retinoid, that is going to increase collagen, increase elasticity. It's going to improve the crepiness of the skin and the overall texture of the skin, as well as help with any hyperpigmentation that's accumulated there. Vitamin C, same thing. It's gonna help with the wrinkles. It's gonna help with the collagen and the hyperpigmentation. Glycolic acid can turn over the skin, or other AHA, BHA chemical exfoliants, and then really good sun protection. You know, sunscreen is needed on the face, but people forget to put it under their eyes or around their eyes. I treat skin cancer for a living, and I see a lot of skin cancers around the eyes because, again, unless you're wearing sunglasses over that area, it's not a common place that people remember to put sunscreen. And then a good moisturizer is just gonna increase the hydration around the eye and decrease the appearance of the lines underneath the eye. So your skincare routine is actually gonna do double duty as your eye cream. Now that being said, there are some ingredients, if you're looking for a little extra, that some eye creams have that your regular skincare routine is not gonna have. The most common one is caffeine. Caffeine, again, constricts the blood vessels and it decreases the appearance of the pigmentation underneath the eye and decreases swelling. So if you are gonna use an eye cream, look for one that contains caffeine as well as the other active ingredients that I already mentioned. I personally like the Ordinary Multi-Peptide Eye Serum. It has niacinamide, it has glycolic acid, it has a little bit of caffeine in it. I think it adds a little bit extra, but again, all of these things can help. There are a lot of at-home hacks you may see for under eye circles and puffiness, including putting ground coffee grinds underneath the eyes, putting hemorrhoid cream underneath the eyes. All of those things actually will work the same way as caffeine. They constrict the blood vessels, but they're certainly going to be messier than using an eye cream or an eye serum, but they're not going to do any harm either. If you're looking for a more significant improvement, then fillers underneath the eye to fill that hole here, that sort of divot here, can help, and they're temporary, usually lasting between 6 and 18 months. Laser can again increase collagen and reduce the appearance of fine lines and swelling. And then a lower lid blepharoplasty can cause a more permanent long-term solution. The key for all these is you're really looking for a highly trained, qualified medical professional, especially when it comes to that lower lid blepharoplasty. So essentially what happens with the lower lid blepharoplasty is they go in and they either remove some fat or move up the fat to fix it back into place. The risk of that is that you get pull downward on the lower eyelid. That's something called an ectropion. And the reason we need our eyelids to sit right on the eyeball is so that you don't get tearing, you don't get dryness of the eye. So if you have an ectropion, that can be a long-term or permanent side effect of a lower lid blepharoplasty and can be quite serious. And so even though it is the most permanent and most obvious change you can make for your lower eyelids, it also has the highest cost and the highest risk associated with it, as well as quite a lot of downtime in that you're gonna look like you got in a fight afterwards in terms of the swelling and bruising. Unlike an upper eyelid blepharoplasty, insurance rarely will cover a lower eyelid blepharoplasty because it's not considered medical necessity, and so it can be quite costly. All in all, it's really important to seek out a highly trained specialist to do a lower lid blepharoplasty, ideally an oculoplastic surgeon or a surgeon that is specifically trained to do this procedure. So the fourth cause of lines underneath the eyes and puffiness under the eyes is just genetic. Like anything on our face, we all look slightly different. The anatomy is slightly different. And so based on your ligaments and the distribution of the fat under the eyelid, you may genetically have a darker appearance or lines under the eyes or puffiness under the eyes. A clue that this is the case is that you've had them since you were really young and they look similar to your parents and or your siblings. So again, if they are bothersome to you and you're looking to do something, then the same type of treatments will work. The filler under the eye, laser, and then for a more permanent solution, a lower eyelid blepharoplasty. And so fifth, last but not least, are health problems that are causing lower eyelid swelling and lines. So there are many different health conditions that can cause periorbital edema, swelling, and even accentuated lines underneath the eyes. Any health condition related to the kidneys can possibly contribute to eyelid swelling, particularly something called nephrotic syndrome, where you spill protein out of your urine and you can have pretty significant periorbital edema and swelling. Graves' disease, which is related to hyperthyroidism, can cause proptosis and sort of the accentuation underneath the eyes. Angioedema, which is like an acute onset of swelling around the eyes. It's related to hives. It's part of the sort of same urticarial process where there's a ton of acute inflammation and swelling. It can go along with anaphylaxis, where you're having an allergy where you're in serious danger of having difficulty breathing. So those can go along with the eye swelling. And then unilateral eyelid swelling is never normal. Besides angioedema, you can consider infections such as Chagas disease, cellulitis, certain tumors of the eye can present as unilateral swelling of the eye. So again, the red flags that you're looking out for that you need to seek medical care is it's unilateral or it's acute. The onset was fast, associated with pain, associated with vision changes. And if it's associated with any other systemic symptoms like fever or chills, any of these, you need to seek medical advice. So please leave in the comments what's worked for you for under eye circles, puffiness, things that have worked better, things that haven't worked at all. I'm Dr. Abby Waldman. Be well.